Hi, I am Pabo here, and today my poster title is Alzheimer's Dementia, which is one of the major issues in Australia. This poster has developed for the audience of carers aged 60 to 70 years age limits. I worked with this poster to define the health issue with some background information including function in human body and the impact of Alzheimer's disease for humans' quality of life. This illustrates that Alzheimer's disease must cause in impairing memory, thinking, and their behaviors. Next, the poster has described the epidemiological factors in Australia with few statistics. This has mentioned that the elements which increase the risk of developing Alzheimer's disease. Also, this categorized under non-modified factors such as age, family history, genetics. Also, the modified factors such as diabetes, lack of mental exercises, physical inactivity, obesity, and finally high cholesterol and high blood pressure. These modified factors most common with this health issue that Alzheimer's disease, because if the patient wants to cure this disease, they should focus on these modified risk factors importantly. Also, there are several factors and determinants that can influence health of Alzheimer's patients. Dealing with Alzheimer's dementia is hard, but there are several factors which could categorize where human is born, live, study, employed, and active. These determinants are called social factors. In addition, there are another risk factors which called as behaviors factors. These behaviors factors examples are physical activity such as exercises, alcohol consumption, nutrition, and using illegal drugs. These determinants also could be modified with the patient's current situation. Despite the main categories, there are other risk factors which contribute the Alzheimer's patient's life cycle. My first example is head injury. If a person got injured his or her head in their 30s, this may result to diagnosis with Alzheimer's disease in their 60s. It means this can be an ongoing situation with any human being. My third example making to have a good life, to have a good head, people must have a good heart. As my second example described, that the brain should have a continuous supply of blood and oxygen to perform well. If this would be decreased, could be decreased, the risk of Alzheimer's disease could be increased. So this is really important as our respiratory system. Patients with Alzheimer's disease may have happy and sad lives since it impacts on their quality of life. Even though there is no cure for Alzheimer's disease, people can manage and monitor through various strategies. As a carer, it is important to identify and acknowledge patients' condition and give a better care to improve their life cycle. Health promotion through education, opportunities, quality of life, and improving welfare can solve the Alzheimer's disease circumstances. In conclusion, I created this poster to present about Alzheimer's disease, which is main health problem in Australia nowadays. This could be an opportunity for me and my friends to understand and understand the current situation and control the Alzheimer's disease with Alzheimer's patients. Any questions? Thank you for listening my post presentation. Goodbye.